Have you ever looked at all the medicines that you're taking and asked yourself, do I really need to take all these medicines? And is it possible that some of them are hurting me more than they're helping? Well, in this video, we're going to look at some common drugs that you might be taking that can hurt your brain and affect your memory. One group of drugs that many people are taking every day is anticholinergic drugs. These medicines are well known to cause or worsen memory loss, and long-term use has also been linked to developing Alzheimer's disease and other types of dementia later in life. And if we know that these medicines can hurt the brain, why are we still using them? I'll come back to that later. So let's talk about these anticholinergic drugs. What are they? What do they do to your body and your brain? And we'll also look at some of the common anticholinergic medicines that you or a family member might be taking. Acetylcholine is a chemical that helps brain and nerve cells to talk to each other and to other parts of the body. In your brain, this talking translates into learning, thinking, remembering, solving problems, paying attention, and making decisions. Outside your brain, the part of the nervous system called the autonomic nervous system, you could think of it as the automatic nervous system, controls processes in the body that you mostly don't control yourself. Things like your heartbeat, like breathing, and your digestion. And it's divided into three parts. The part that controls everything in your gut, that's the enteric nervous system. The sympathetic part, which keeps us alert and ready for action, which is what we call the flight or fight part of your nervous system. And then we have the parasympathetic nervous system, which we sometimes call the rest and digest part of your nervous system, which balances out the flight or fight part. The rest and digest, that's the parasympathetic nervous system, uses mostly acetylcholine. And there are certain situations in which we would want to calm down that rest and digest part of your nervous system. And we'll look at some of those situations later. But the drugs that you would use to do this are called anticholinergic drugs because they oppose the action of acetylcholine. But remember that acetylcholine isn't only used in your rest and digest nervous system. Acetylcholine is also what your brain cells use to talk to each other. So when you block the action of acetylcholine in other parts of the body, you're also blocking the actions of acetylcholine in your brain, which means that your brain cells can't talk to each other properly. So you become distracted, you forget things easily, and you can't pay attention. If your brain cells can't talk to each other properly, you become drowsy and slow, and this increases your risk of falling. And falls in older adults can easily lead to broken bones and head injuries, and many older adults don't recover from these very well. And here's another thing to think about. There are drugs like Aricept, which were developed to help people with Alzheimer's disease to improve memory and brain function. These drugs increase the amount of acetylcholine in the brain. And here we are giving drugs that block acetylcholine and reduce acetylcholine in the brain to older adults who may already be having problems with memory and thinking. It doesn't make sense. So let's look at some common anticholinergic drugs that you might be taking that can hurt your brain. The first type of medicines we're going to look at are the ones that you can buy at the chemist or at the drugstore for allergies, cold and flu symptoms like a runny nose, like sneezing, like coughing and itching. These drugs are called antihistamines, and the ones that make you sleepy are the ones that can hurt your brain the most. Examples of these are diphenhydramine and chlorpheniramine. The newer types of antihistamines are better because they make you less sleepy and they're still effective. Examples of these are loratadine and cetirizine. Closely related to the previous group of drugs are the nighttime or PM versions of common painkillers. These include Tylenol PM, Advil PM, NyQuil, Aleve PM, Unisom, etc. Not only do these nighttime or PM versions contain the painkiller, they also contain the same thing that you have in your cough and cold and flu remedies that makes you drowsy. And we know that these medicines can hurt your brain. So if you want to take a painkiller, take the daytime version and try and find other alternatives to help you sleep. Another problem that anticholinergic drugs are often recommended for is itchy skin, and sometimes there's no obvious reason for the itchy skin. So some drugs that might be recommended for this include diphenhydramine again and hydroxyzine. It would be worth switching to something that you can rub on your skin. For example, diphenhydramine does come as a cream. And when you apply these things to your skin, less of it is absorbed into your blood. That means that less of it goes to your brain to cause problems. And older adults are much more likely to have dry skin because as you get older, skin function goes down. So you really need to take care of your skin, try and get a good moisturizer. And there are lots of moisturizers on the market nowadays that actually contain ingredients that help with itching. Next up are anticholinergic drugs used to stop vomiting, and they're commonly used to treat or prevent motion sickness. And these drugs include dimenhydrinate, meclizine, and scopolamine. These drugs are also used to treat a condition known as vertigo. Vertigo is when you have that sensation of standing still, but everything around you is just spinning and moving. People often confuse vertigo with some other things like feeling lightheaded, feeling weak, feeling unsteady or off balance, or feeling faint. And so these drugs might be prescribed for you when you don't actually have vertigo, you have something else. Sometimes these feelings can come if your blood sugar is very low or if you have low blood pressure, especially when you stand up. And these can be remedied by having a look at your medication and by doing things like not standing up too fast and rolling over before you get out of bed and things like that. And even if you do have vertigo, there are different kinds of physical therapy that can be used to treat it so that you can avoid taking the anticholinergic drugs that have the possibility of hurting your brain. The next group of drugs that can hurt your brain are some of the ones that are used to treat nerve pain. These tend to be the older antidepressant drugs like amitriptyline and nortriptyline. And these drugs can slow down your brain if you use them for a long time. For diabetic nerve pain in particular, there are some supplements that you can take that can help, but ultimately, bringing down your blood sugar, if it's high, can help to relieve some of the pain. And I have lots of videos on the channel, I'll link to some in the description, about how to bring down your blood sugar naturally. Another way in which anticholinergics are used is to treat back and neck pain. And this can become very, very common as you get older. A lot of back and neck pain is actually caused by muscle spasms. So when the muscles are permanently contracted, that causes a lot of pain. So anticholinergic drugs can be used to help the muscles relax, and this reduces the pain. And a common drug that's used for this is cyclobenzaprine. And for this kind of pain, there are other ways to relieve it. For example, there are some creams and balms that you can apply to the skin that can help to relieve some of these pains. Also, you need to look at things like your pillow and your mattress, because if they're too hard or too soft, that can cause muscle spasms and pain. And then you need to make sure that you're getting enough vitamins, minerals like magnesium, potassium, and salt in your diet. Another type of anticholinergic drug that your doctor might prescribe for you is medicine for an overactive bladder. In this situation, what happens is that your rest and digest system becomes hyperactive and it causes your bladder to contract even when it's not full. So when you take an anticholinergic drug, it blocks the action of acetylcholine, which means that the bladder can relax. Drugs that relax the bladder include oxybutynin, tolterodine, and solifenacin. But it's always best to try other types of therapy for overactive bladder and only use these anticholinergic drugs when it's absolutely necessary and nothing else has worked. Back to the question we asked earlier. If we know that anticholinergic drugs hurt the brain, why are we still using them? Well, first of all, in younger people in their 30s and 40s, they don't really have a problem taking anticholinergics. But most doctors don't know that as you get older, in older adults, that these anticholinergics can actually hurt the brain. The second problem is that most people don't know about the side effects of these anticholinergics, that they can hurt the brain, and you don't really expect them to. But what happens is that you might find that you're taking 4 or 5 anticholinergic drugs at the same time. When you add the ones that you bought at the drugstore, at the chemist, and the ones that your doctor has prescribed for you. So we have millions of older adults taking medicines that are hurting their brain, and they just have no idea that this is happening. Who should be most worried about taking anticholinergic drugs? First of all, if you or a family member has been diagnosed with mild cognitive impairment, that's where you have a slight reduction in your mental abilities, or diagnosed with dementia. These drugs need to be avoided or kept to the absolute minimum dose possible. If you've noticed that you're having problems with thinking, with memory, you might like to take a closer look at the drugs that you're taking. Long-term use of anticholinergic drugs has been linked to developing Alzheimer's disease later in life. So if you have a history of Alzheimer's disease in your family, you may want to avoid anticholinergic drugs. And then again, if you also want to reduce your risk of getting Alzheimer's later in life, then you'd probably want to avoid them as much as possible. Even when you do take anticholinergics, try and make sure that you take the lowest effective dose possible for the shortest period of time. One of the best ways to protect your brain and prevent Alzheimer's disease later in life is to make sure that you control your blood sugar. And I'll show you step by step how to do that naturally in the next video.